Dr. Mobley here to go over some basic but very important information you need to know after undergoing any sort of facial plastic surgery procedure. First and foremost, in my practice, you're going to get some post-operative instructions. Keep in mind, these have evolved over a decade in practice, and every word typed here is from me. So it's basically me talking to you in the typewritten form. So please read them all. Typically, the first few pages are very general and cover a lot of the same information, but deeper in each section is information specific to the procedure underwent. So that's one important detail. Next thing is, let's talk a little bit about your post-operative medications. We're going to give you post-op antibiotics, post-op pain pills, and anti-nausea pills. A lot of people don't know quite how to manage those medications in, say, the first 24 hours after surgery. Here are my guiding principles. So if you get home and you're having post-operative pain but your stomach's not settled, I would recommend not taking the narcotic painkiller. A narcotic painkiller, either the Norco or the Percocet, on an unsettled stomach almost always makes you feel more nauseous in the end, so you feel worse, not better. Focus on getting some food in your stomach, bland things like saltine crackers, applesauce, things that are just very settling. Once you have a cushion of food in your stomach, then it's okay to take the painkiller. Until then, my recommendation, just take over-the-counter Tylenol for pain. It won't be as powerful as the narcotic, but it won't cause nausea, and in the end, you'll actually feel better. Now, you'll also be given some anti-nausea medication, either phenergan, which is a tablet, or Zofran, which is a tablet that dissolves under your tongue. Use that to help you get your stomach settled. So getting the stomach settled, getting some food in your stomach is a top priority. Then once you have some food in your stomach, then take the painkiller. Again, if your stomach is queasy, just take over-the-counter Tylenol. Finally, the antibiotic. We're not treating an infection after facial plastic surgery, it's a preventative antibiotic. So that's the one that could be the lowest priority. If your stomach's not settled, you can wait till the morning after your surgery to start the antibiotic. You receive antibiotics in the operating room during your procedure, so don't feel bad if you have to wait maybe 12 to 24 hours before starting the antibiotic. Now, in case you had a longer surgery, let's say 4 hours or longer, there's even some more information I want to share with you next. So let's say you've had a longer surgery. Typically these are more the facelifts, the neck lifts, or combining multiple procedures into one day. And in my mind, while there's some variability, a longer surgery is maybe 4 hours or longer. Here are some general rules to follow after a longer surgery. First, I can tell you what to do by telling you what not to do. Don't leave the surgical facility, go home, pop 2 painkillers, and then take another 4 or 5 hour nap on the couch. That's not what you want to do. You need to mobilize after elective surgery. About once an hour during the waking hours, take a light walk around your house. And when you walk around, stabilize yourself on, say, a countertop and do simple little calf raises. You want to squeeze your calves a lot after surgery. While I've never had it happen, there are risks of a clot forming in your leg which can go to your lung, which can literally be a life-threatening problem. So keeping your calves and your legs in general flexed after several hours of surgery is critical. So move around about once an hour during the waking hours, even if you're laying in bed. When you're laying in bed, about once every 30 to 60 minutes, just think, oh, I'm going to squeeze my calves, I'm going to squeeze my shins, squeeze my thighs, squeeze my buttocks. Do those things so that your blood is flowing through your lower extremities. That's really important for your personal safety, particularly after a longer operation. Second, and this goes right along with that, stay hydrated. I recommend sort of a diluted sports drink, so a Powerade or a Gatorade. Mix it 1-to-1 with a little water so maybe it's not too sweet, and drink that frequently. By drinking that frequently, you stay hydrated, and when you're hydrated, you're less likely to feel nauseous, and you're just going to feel better that first 24 hours after getting over anesthesia. Plus, it kind of plays together, because if you're hydrated, you're going to have to get up and go to the bathroom every once in a while. That gets you out of bed, it keeps you walking around. So those sort of play well together and complement each other. Third principle that's really important, take deep breaths. When you're on anesthesia for several hours, the lower parts of our lungs don't inflate regularly because of some issues of human pulmonary physiology. It's too complex, that doesn't matter. But the big picture is, about once an hour during the waking hours, take a big barrel-chested breath. Breathe in deeply to the point that you really feel you've inflated your lungs from the top to the bottom. Hold it for like a 5-second count and let it out. Taking those deep breaths once an hour keeps your lungs really nice and aerated, and you're just going to feel better. So by combining early mobility, good hydration, and taking deep breaths, those 3 things will keep you out of a lot of trouble. If there's ever any problems on call, you're going to have my cell phone, call me directly. But following those principles are very important, particularly after surgery that's longer than, say, 4 hours.